Now we'll move on below the skull postcrania of the axial skeleton. The first bone that we're going to look at is called the hyoid bone, and you can see it floating right here. It is held in place by muscles and tendons, and it's a really important bone because it's going to be useful to determine whether or not hominins were capable of speech. So the hyoid is inferior to the mandible, anterior to the cervical vertebrae, and superior to the sternum. Here's the hyoid bone. It fits in the palm of my hand, and it acts as an anchor for the tongue to allow the tongue to move in sync with the larynx, enabling the ability of dexterous speech. Now, it kind of looks like vampire teeth. These are features. These are called the lesser horns, the two canine-looking teeth of our vampire teeth set here. And the greater horns are those on the posterior side. This in the middle is considered the body. And so here the hyoid is pictured articulated with a skeleton. Now remember, it doesn't articulate with any bones, but it's held in place by muscles and tendons. And so which letter is pointing to the hyoid? Now we will talk about the vertebral column, otherwise known as the spine. There are 5 sections of the spine that you will need to know, and you will need to be able to differentiate between the different types of vertebrae. So we have our cervical vertebrae section. That's the first section, the most superior. Then we have the thoracic vertebrae. And next we have the lumbar section. And after that, we have the sacral section. And finally, the coccygeal section of the vertebral column. Okay, so now we'll go into the cervical section. There are 7 vertebrae in the cervical section. There are several ways to distinguish between other types of vertebrae and the cervical vertebrae. One is that the cervical vertebrae tend to be smaller than the other vertebrae. In addition, the spinous process, this part right here that sticks out posteriorly, this sticks usually straight out. Cervical vertebrae number 1 is called atlas because it holds the world on its shoulders, meaning it articulates with the occipital condyles of the skull. So it's holding the world on its shoulders, or its facets. What's unique about the atlas is that it doesn't have a body. So there's no vertebral body. In addition, it doesn't really have a spinous process. So this is the posterior side, and the projection of the bone is slight. Cervical vertebrae number 2 is unique because of this landmark right here on the superior anterior portion of the cervical vertebrae number 2. And this is called axis because it rotates the world on its axis. So it allows the skull to swivel. How you can tell the difference between cervical vertebrae and other vertebrae is that oftentimes, although not always, but on my exam that will be the case, oftentimes the spinous process is bifurcated, meaning it has kind of a forked tongue. So the bifurcated spinous process is one clue you're looking at a cervical vertebra. Another clue is what's called transverse foramen. Does anybody remember what a foramen is? Foramen is a hole. And so you have the vertebral foramen, which is the hole that goes down the middle, but you also have the transverse foramen, and these are holes on either side. So here is a thoracic vertebra, and as you can see, the nose, or the spinous process, see, this kind of looks like a giraffe. These are the ears, these are the horns, and this is the nose of the giraffe. So if you compare the nose, or the spinous process of the thoracic vertebrae to the spinous process of the cervical vertebrae, the nose on the thoracic points down, so it points inferiorly. Another way to tell if you're looking at a thoracic rather than a cervical is by way of the rib facets. So if you look on the lateral portion of the thoracic vertebra, you will see this facet here and here. This is where the ribs articulate with the thoracic vertebrae. So thoracic is unique because ribs articulate to them. Ribs do not articulate to the cervical vertebrae. Ribs only articulate to the thoracic. And remember, this is posterior view. Then for the lumbar vertebrae, you really can use size as an indicator. So typically the lumbar is chunkier, the vertebral body of the lumbar is chunkier, and they're just more robust and bigger. Another way you can tell you're looking at a lumbar is by the blunt and short spinous process. So compare this blunt, short spinous process to the longer, inferiorly pointing spinous process of the thoracic vertebra. And the lumbar vertebrae kind of look like a moose. And there are 5 lumbar. The next section of the vertebral column is the sacral section, which is referred to as the sacrum. And the sacrum actually comprises of fused vertebrae. So if you look here, you can see that there's a line or a suture separating each vertebrae piece. And that's how you can count how many vertebrae are fused together to make your sacrum. So there's 1, 2, 3, 4, 5. And this line marks the end of the sacrum. And then it becomes the coccyx. Landmarks that you will need to know on the sacrum are called sacral foramina, which are these little holes. You will also need to know where the sacrum articulates with other bones. So this portion articulates with the 5th lumbar. This roughened surface on one side and on the other is the point of articulation with the os coxa, otherwise known as the innominate of the pelvis. And the coccyx is your tailbone, and it is sometimes fused to the sacrum, as in this piece right here, and sometimes it is disarticulated. So the coccyx is made up of also fused together vertebrae, and so you can count them by looking at the suture. So there's 1, 2, 3, 4 fused vertebrae to make the coccyx.